So in terms of baby boomers pushing this integrative medicine philosophy along, do you think we've made big strides in the last 10 years, or are we creeping along? Are you happy with where integrative medicine is right now?
It's still in the early phases. The Institute of Medicine just had a huge integrative medicine summit in Washington, D.C. just a couple of months ago. Over 700 clinicians and researchers were there. And we were really looking at a snapshot of what's the current state of integrative medicine in terms of training health professionals, in terms of how much money it's costing, in terms of what are the chronic conditions that we need to treat better, in terms of how do we need to educate the public better about it. And it's really gaining more of a critical mass, but we still have a long way to go.
One of the things that has surprised me as I've watched the movement is that it hasn't been covered by insurance. Integrative medicine hasn't been covered as well as we would like. Why is that? Because it's often cheaper to treat someone with a complementary type technique.
That's a really good question, and there's a number of factors. One is those of us who practice integrative medicine who have a professional degree get covered by insurance to do the treatments we do. Psychologists, physicians, dentists, whatever. But we do the integrative treatments under that rubric, even though it's not listed as an integrative medicine treatment per se. Another factor is that the pharmaceutical companies really try to inform research and really try to inform and enthusiastically push drug treatments for certain conditions. And I think another part is we need to get more research out there, because ultimately insurance looks for empirically validated treatments. Now with what's happening economically, now what's happening with the Obama administration coming in and talking about healthcare reform, I know the Institute of Medicine is getting actively involved in educating legislators about what's at stake, and that really it's chronic illness that's costing us trillions of dollars a year, and that these integrative treatments really have an important place. And I think that's being looked at more now.
So are you hopeful that with the proposals that we'll see coming out of Congress, integrative medicine will be in there? Will it be part of the main packages?
I certainly think it'll be more of the package than it has been. Okay. And part of the reason will be because of the recognition of the cost of chronic illnesses versus acute illnesses. And I think another part is there's enough public awareness that there's a demand for it. And I think economics drive this to a great extent. I think one of the reasons that a lot of hospitals started integrative medicine programs was not because they were suddenly enlightened by the research. Instead, I think they saw, like David Eisenberg's study from Harvard back a number of years ago, that said that people were spending over $20 billion a year out of pocket.
And I remember reading that 1/3 of all Americans said they were seeking some kind of alternative treatment. And this was maybe 10 or 15 years ago.
Yeah,
so
I'm sure
it's gone up.
It's much greater now.
Much greater, okay.
And the problem is a lot of us clinicians in clinical settings, if we don't ask, don't know what other treatments the patients are getting. And so it's becoming more common that we're being reminded to ask our patients, well, in addition to these medications, what else are you doing? Are you getting acupuncture? Are you taking supplements? Are you taking herbs? What other things are you doing? Because they interact with the other treatments.
So do you feel your main job as someone who is wanting to inform people about integrative medicine, is it to persuade the professionals first, or is it to empower the patients?
Well, I'm really working on different fronts. Like myself, many who are in the integrative medicine field are clinicians seeing patients. We're doing research, we're writing. I'm currently in the process of writing a book with Greg Plotnikoff, who's the medical director of the Institute for Health and Healing at the local program at Abbott Northwestern Hospital. Part of it is making literature available for insurers about the cost savings from these treatments. My patients will also ask about, boy, this treatment really helped me, Dr. Weisberg. Are there ways to let other people know about it? And so satisfied patients become good messengers of the message as well.
When you talk about the chronic illnesses that are causing our healthcare system to kind of stagger, what are the biggies that you think of when you think of that besides diabetes, which we've talked about?
Cardiovascular disease, certainly, stroke, cancers.
And they're all considered chronic.
Yes.
I know heart disease would be. I wouldn't have put cancer in there.
Well, it depends. It depends on the course. If you have a cancer that is caught and treated early and there's no remission, I mean, if there's no recurrence and it's in remission, you might say that's more acute. But technically, Mary, we think of a chronic illness that anything that lasts more than 3 to 6 months. And of course, many people who have cancer have recurrence.
Right,
So for many people, it is a chronic condition.
And whether they have reoccurrence or not, it's hanging over their heads for years as a concern.
There's also many digestive diseases that can be chronic, not just the inflammatory bowel diseases like Crohn's and ulcerative colitis, but also irritable bowel syndrome, which affects about 10 to 15% of all Americans.
Really?
Yeah, they comprise about half of all stomach specialists practice. So that's another one where there's millions and millions of dollars spent on treatments.
You know, one of the things that you use in your practice is hypnosis. And I read that hypnosis is used with irritable bowel syndrome. And I was not quite sure how to put those two together, but this is a good segue into it. How do you use hypnosis?
Well, it's interesting.
With this kind of chronic disease.
I mean, of course, when a lot of people hear hypnosis, they think of making somebody bark like a dog, unfortunately, from stage hypnosis. But the fact is, hypnosis has been widely studied. And with the advent of neuroimaging techniques in the past 15, 20 years of PET scans and functional MRIs, we're able to see exactly which parts of the brain are affected through hypnotic interventions. We know that irritable bowel syndrome is largely caused by our autonomic nervous system being dysregulated. And much of the serotonin receptors in our body, we think of serotonin affecting our brain,
right.
With depression and those sorts of things. 95% of the serotonin receptors in our body are in our gut and are very much affected by our autonomic nervous system. Hypnosis, we think, works by altering the balance of the autonomic nervous system through our brain, our spinal cord, and our body, and therefore having an effect on adjusting the balance that affects the neurophysiology of the colon and can affect symptoms of pain and bloating and motility problems and all of that. It's so robust that in some studies done in The Lancet in the past few years that were published there, 95% of all patients under the age of 50 who had hypnosis as part of the treatment had a partial or complete recovery from the symptoms.
Wow.
It's so robust that the World Health Organization now is saying it's really irresponsible not to consider hypnosis as part of the treatment along with diet and other considerations.
So when you say it is robust, you mean the research is robust?
The experimental effect of the hypnosis on the irritable bowel
that particular syndrome
is very powerful.
What else do you see hypnosis really being effective with?
We are using it a lot now to help people prepare for surgery and other invasive procedures. Of course, as a public health consideration, we want more people to get colonoscopy, to get mammograms, and of course some of those women have to have biopsies. Other diagnostic procedures, and of course preparing for surgery.
So as a way to get people to relax,
certainly getting people to relax, but also changing physiological parameters. You can use hypnosis to lower heart rate. You can use hypnosis to decrease bleeding after surgery. You can use hypnosis to speed up the return of normal bowel function after surgery and decrease the need for the amount of anesthetic that's used during the procedures as well.
So those are very important uses, aren't they?
And save millions of dollars, not to mention helping patients recover more quickly and get back to their activities of daily living.
Shorter hospital stays.
Oh, yeah. So the insurers are interested in that.